This
Yes.
air is passing through the nose, right? So when the air is passing through the nose, it's proper. But whenever we have a something obstructions like this, you can see the redness over here, right? So this redness is
Hmm.
forming some obstruction. See, using pranam and all those not only reduces the stress, but also they make your breathing more deeper, right? A dentist cannot avoid your interdental decay as much as the flossing can avoid. And I have seen
Hmm.
my patients who are using dental floss and the twice a day brushing since long, and they are not coming up with more decay.
Don't really understand the root cause of the problem. We just, if there is some problem with your respiratory system, we try to address that rather than addressing the root cause, which you are mentioning today. Hello, everyone. Namaste. Today, I am with Dr. Hemant. Welcome you all to Breathe Well and Live Well. As you all know, 10 out of 9 people are suffering with some or the other dental problems. Today, we are going to discuss how breathing also play a crucial role in your dental hygiene or dental health. So today I have Dr. Hemant who is going to explain us how breathing influence on your dental health, oral health and overall health. So as you all know, without our mouth we cannot eat anything. For us as a living beings, we need only three things: water, food, and air. Without food, we cannot live. To eat food, you need mouth. To eat food, you need teeth. So you might have seen many old people who are suffering because they do not have teeth. So the dental hygiene or dental health plays a crucial role in your overall health. So today, the expert speaker, Dr. Hemant, is going to explain us about the importance of dental health, oral hygiene, as well as the relationship between breathing and dental health. Welcome you all again. I am your host, Badrinath Gella. So let me introduce you all to Dr. Hemant. So Dr. Hemant Patil is a highly qualified dentist, prosthodontist and implantologist based in Pune. He possesses an impressive educational background, having earned his dental degree and master's in dental surgery and implantology from prestigious government dental college and hospital in Mumbai. Not only was Dr. Patil as an assistant professor at the same institution where he taught dental students, interns, and clinical staff, but he also pursued advanced training in implantology through mastership in implants from Stocky Brook University, USA, New York. With years of experience serving as a specialist in government hospital, Dr. Patil is now a sought-after consultant, prosthodontist, and implantologist, offering his expertise at various hospitals and rehabilitation centers in both Pune and Mumbai. It is our pleasure to have Dr. Patil, Hemant Patil. Thank you so much for accepting my request and coming here to educate our audience on oral hygiene and the relationship between breath and oral hygiene.
Thank you, Badrinath.
Thank-
Thank you for having
Yes.
this honor, and I
No.
appreciate your work and help. You are helping a lot of people in breathing and the breathing practices, and I'm inspired with that also. And I'm very much excited to give this whatever the knowledge I have to share with your community. Thank you again.
Thank you, Dr. Patil. As I said, not just 10 out of 9 people, the people whom I know, including my extended family, my whole family, they are also suffering with dental issues. Some are the other dental issues, right? So, like, and also, as I read about the breathing and also about the pranayama techniques, I understood that the there is a lot of relationship between breathing and dental health. So could you please explain about what is the relationship between dental health and breathing?
Yes, sure. So, breathing, as we have seen before in the sorry, so breathing, as we see, generally comes through the nose, and normally most of the time from the childhood, most of the kids may or may not have the nose breathing or the nasal breathing, and that's why they breathe it through the mouth. So when they breathe it through the mouth, there are a lot of incorrect postures, incorrect formations happen. So I would like to show you a small video where we can able to see it better. So
Okay.
just yeah. So if you can see in this
The
video,
normal way to
so if you can see
Yes.
this air is passing through the nose, right? So when the air is passing through the nose, it's proper. But whenever we have a something obstructions like this, you can see the redness over here, right? So this redness is
Hmm.
forming some obstruction. So this obstruction can be because of some nasal polyps, can be because of some nasal cyst, or maybe because of either the increased adenoids or tonsils. So either because of any of those blockages, these nasal breathing gets obstructed, and whenever it get obstructed, then patient try to gasp and then he starts breathing through his mouth, and then only the problem starts coming in. So can you see now the arrows have started going from here also? That means he has started taking the breathing from mouth, because he is getting,
Hmm.
if we can see in this region, he is getting obstruction in this nasal passage, right? And that's why he has started
Hmm.
taking the breathing from the mouth. And when he starts taking
Hmm.
from the mouth, then comes the problem that when he takes air from the mouth, most of the time his teeth, his jaw gets more and more dry. And when it gets more and more dry, that comes with lots of dental problems. And when those dental problem increases, again there is a more chance that his mouth gets more and more dry, and the cycle continues. And that's why breathing pattern has a very high
Hmm.
impact on the mouth. And this is especially applicable when the patient or the person is in very early childhood. And if that's why I would suggest all of you to start identifying this from the childhood. Means if you are a person who is adult, then start identifying this from your kids at the age of 5 at least, and also identify with yourself also. So that is the one thing.
So what I
uh,
understood is they have to take care at the early stage to avoid many problems, many long
yeah,
term problems. Is that so?
yeah, yes. So the first identification could be for anyone, like not for kids, but even for the adults also. Start
Hmm.
closing your mouth. matlab, For a intentionally keep your mouth closed for 2 minutes and start breathing through your nose. And if you are not comfortable almost for 2 minutes, then it's okay. But if you are uncomfortable while breathing through the nose, then that indicates that you are a mouth breather, and that is a
Hmm.
warning sign in a one way that you are a mouth breather. And that's how the mouth breathing or the breathing, incorrect breathing, has an impact on the dental health also. There are various issues also we are coming up seeing in the further course of the video. So those are all other features also, what it affects on the dental health, that also we are going to see.
Hmm. Okay. But can mouth breathing lead to dental problems? If so, how?
Yes, sure. So mouth breathing obviously can affect the dental, and how, that I'm going to explain you now. So as we have seen in the video, whenever the nasal congestion happens, the patient tries to breathe in through the mouth, right? So when he
Hmm.
breathe in through the mouth, that is known as a mouth breathing. When he mouth breathes, most of the time it happens in the night or even in the daytime also some. So whenever he does that, that time the more and the more passing through the mouth allows the mouth to get dry, and that allows our tongue to get dry, our teeth to get dry, and our salivary consumption and salivary formation also reduces. And as we all know that saliva is very important part of our jaw and the overall musculature system. When the saliva reduces, our cleansing of teeth also reduces, and that leads to more and more decay. Also, along
Hmm.
with the decay, this mouth breathing slowly allows your palate, which is the upper part of your jaw, also go little more narrow and upsize. That also makes your face in little longer in terms of your overall face height, and also makes your teeth also come forward. And that's why most of the mouth breathers, if you see, they have a front face teeth that we term in a science wise language as a proclination. That means your teeth comes up outside, and that also
Hmm.
happens with the mouth breathers. Also, there are
Hmm.
other disadvantages also of a mouth breathing in terms of orificial structure, apart from the decay and apart from these teeth positioning, and also some throat related issues also. And that's what we ask, that you should able to detect this mouth breathing at earliest stage as possible, and even the other problems also as earliest as possible, like snoring. There's a main problem, like a lot of people snores, and that mouth breathing is one of a main cause of causing that problem, the snoring.
Oh, wow. So many side effects due to mouth breathing. Just by that's why God has given nose separately, mouth separately. So like nose is for breathing, mouth is for eating. So we are changing the biological aspect of our mouth and nose, which will lead to many other problems. So
Yes.
thank you so much for answering this question. But what are some of the dental problems due to incorrect breathing?
So, some more dental problems could be gingivitis, that means gum inflammation. So,
Hmm.
even the one of a big role is in the saliva only, because the saliva is able to clean our teeth and gums. And when the
Okay.
mouth breather has these issues, and that's why the saliva reduces, and that also leads to gingivitis or the gum inflammation. Even because of more and more air also, and getting the mouth dry, that also creates the gingivitis. Also, along with that, even a lot of patients comes to me with bad breath, that terms as a
Hmm.
halitosis. Bad breath also happens because of mouth breathing. And a lot of dentists, I see a lot of dentists giving toothpaste, mouthwash, or even they do
Hmm.
cleaning and all. But instead of that, also a lot of efforts. I see a lot of people put a lot of efforts while reducing that mouth staining and mouth breathing problems, but still they have that issues. And why they do have that issues? Because the back of the cause, which is a mouth breathing, is not get cured, and that's why the halitosis or the foul smell, it doesn't go off.
Hmm. So bad breathing means foul smell, or what exactly it
Yeah.
is?
So foul smell means whenever we speak, we
Hmm.
emit some sort of a foul
Yeah.
smell, right? So,
Yes.
example, some
I see
if
many
you if
people.
you if you can see a lot of people keep their hands on their face, right? Because they
Hmm.
themselves assume that we are smelling a little bad, right? So
Hmm.
if you have realized that whenever we wake up, that time we have a smell, right, coming in from our mouth.
Hmm.
That's okay.
Hmm.
Because for the whole night our mouth was completely shut, and that's why the smell may come. But while daytime also people have a lot of these mouth smelling issues, which is known as a foul mouth smell or halitosis in terms of scientific language. And all those problems have other causes also, like teeth cleaning is not done, or they have foul, not properly cleaned tongue and all those. But apart from that, mouth breathing is also very important cause of causing this halitosis.
Yeah. And not many people knows that like saliva is an important element to keep your dental like your teeth clean.
Yes,
And like also like saliva has so many minerals which is very
yes,
important for your digestion, for
yes,
your daily action, and many things. Like wow, we just take it as granted, you know. The
yeah,
God has given teeth, so we take it as granted. We don't really recognize unless you have a problem. So people who are watching this, please do not take it granted and listen to this and understand the importance of your dental health. So, Dr. Hemant, currently we are living in a stressful and anxiety world, right? So even though
yes.
we are developed, the everyone are facing stress and anxiety. Can stress and anxiety affect breathing and dental health?
Yes, sure. So, stress is one of a common cause of most of the diseases. As we all know that our all the diseases are psychosomatic. I'll explain you because there's a little scientific word again. So, psycho means a mental part, and somatic means a physical or body part. So, most of the diseases are psychosomatic, but most of them
Hmm.
are mainly related to somehow related to psychological part. That means a mental part, and that's why stress, which affects the psychological part, is very much in big plays a big role in causing the diseases. And that's why stress can cause not only dental but also breathing problems also. So specifically in a dental, whenever there is a stress, there is a lot of muscle stiffness happening. Even our teeth starts grinding down, and that creates to lots and lots of sensitivity in our teeth. Also, stress allows breathing also to be kept more and more shallow. And as Badrinath your itself is a breathing expert, uh, using pranam and all those not only reduces the stress, but also they make your breathing more deeper, right? As you must be guiding in on
Hmm.
this topic much better, right?
Yes, 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 yes. Yeah. So I do educate people like it is a root cause of the problem, and also, but as a like I also heard that like for example, adopting pranayama or breathing techniques, they could able to stop their mouth breathing. So it
Yes.
takes a time, like because from like if you are a mouth breather for 20 years, like it took 20, like how long it will take for you to stop that habit? It will take a lot of time to stop that habit, like.
I'll explain this further. So, along with pranayama, there are other factors also which can also add on. So, first, I would suggest all of you, if you're a mouth breather, the sign what I told initially, that keep your mouth closed for 2 minutes, breathing through your nose, and see if you are comfortably breathing through your nose for 2 minutes. If you are able to do that, then there is no problem. But if you are not, that means you are a proper mouth breather. And if that's so, then you need to identify what was the cause. And to identify that cause, first, suppose you may need to go to either a dentist or a ENT specialist and get yourself check whether you have some nasal congestion or so, or you have some polyps, you have some deviated nasal septum or so. And if that is there, then you need to get corrected those also. So first, as I said, that keep your mouth closed for two
Mm,
minutes. Observe whether you're able to breathe in through your nose or not. If you're not comfortable, that means you're a mouth breather. Then first step could be going to either a ENT or a dentist, mainly ENT specialist, that is a ear, nose, throat specialist, and check for whether you have any nasal congestion, like either a nasal cyst, polyps, or
mm,
something like maybe some deviated nasal septum or something, or there might be some tonsils or so which are got increased. If those are not there, that means that there might be some breathing issues which can be corrected with pranayama also. So along with the pranayama, there is some medical aid if you can need, then you can take that also to check whether there are any obstruction also. And if those are obstructions are there, then you can get cleared with those also. And yes, pranayama helps in one way that even if you have some obstructions which cannot be curable, then also pranayama makes you both the I'm not very expert in that, but yes, there is something known as Chandra and Surya Nadi, right? And
yes.
that pranayama helps you in keeping open with both those nadis and allow you to breathe properly, right? And that will also
Mm,
allow your nasal breathing to happen properly.
yes, 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 yes. Yes, we also have some cleansing practices like Sutraneti and all, which will really remove the obstructions. But yeah,
Yeah,
like
even
this.
Jalneti.
But as I what I understood like from this is like when they are doing any mouth breathing, first they have to visit the doctor. Even I recommend them to visit the doctor to understand the what is the problem.
Yes.
So, if it is it just psychological problem or habitual problem, or is there any problem in your nose, like which is not allowing you to breathe? Understand that. Then, if there is no problem with your nose, you can breathe. There is no obstruction in your breath. Then you can adopt some of the breathing techniques to really improve the quality of your breath. So, my next question is: how can people maintain good dental health to improve their respiratory function?
Yes, so it's a nice question. So a lot of time what happens is when we clean, most of the time we feel that if we are just cleaning once a day, that's enough. But actually,
Mm,
twice a day is very important because we eat for a whole day. And then
mm,
afterwards, if we don't clean our teeth at the night, then it creates more of a depositions, and that allows to have a more and more of a teeth problems. Also, along with that, the flossing also. Flossing is one type of a treatment. It's a home remedy where we use a dental floss, which can be kept between the two teeth and move around. So it will keep your interdental areas clean. So this mouth floss and the brushing twice a day will not only keep your dental health better, but also your lungs and the breathing health also better. Why? Because it is a lot of a scientific study has been done. When we have a decay or when we have a bacterial growth in our teeth and the gums, that may also lead to having infections of the gums, and not only infection of the gums but infection of the lungs and heart also, because those bacteria spread around through your mouth inside the lungs and heart also. And that's why it is mandatory to have a good oral health. That is the first point. Also along with that, when you keep your mouth clean and you visit to a dentist also to keep it better, there are more chances that you are a little more confident in a one way that you are able to take your foods and all properly, because when you're eating properly, that also allows you to see. A lot of people have this burping and all those issues, and that also somehow related to how you chew. And that's also the
Mm.
dental health. If your dental health is nice or proper, then it also affects your overall breathing pattern also.
Mm. Okay, wow, that's amazing. Like, yeah, like, so there are so many factors involved in just with our mouth and dental region, like, which is very good to know.
Even there
So,
are
yeah,
cases found out in
yes,
a
go ahead.
literature that with the
Mm.
dental infections, patient had got a pneumonial infections also because of the dental issues. And that's why we
Mm.
suggest, even with the recent study I was researching with one of a doctor from south itself. So he has put down a photo article where he has found down the gum bacterial growth and the relation with the diabetes even. And that's how the
Mm.
dental oral health, maintenance of a oral health is very important, not only for a dentist, sorry, for the dental treatments, but in terms of overall general health also.
Mm. Yeah. And sometimes we don't really understand the root cause of the problem. We just, if there is some problem with your respiratory system, we try to address that rather than addressing the root cause, which you are mentioning today, right? Because of lack of education on ourselves. This is about
Yes.
knowing ourselves. So I always
Yes.
say, like, even whether yoga, meditation, or knowing about anatomy and physiology or function of our body,
Yes.
right? So by knowing ourselves better, so we can be aware, more aware of ourselves, like our actions, what we are doing on our daily life.
Yes.
That's why I created this talk show, like, to understand yourself, like how your body functions, how your, what is the importance of your teeth, what is the importance of your eyes, and what is the relation between each others. So they all work in a homeostasis, but we humans are not really work together, but they all work in a homeostasis. That's why you could able to maintain your energy or your health properly. So but it's a very enlightening to know that. And what are
Also,
some of the warning signs of breathing related dental problems?
yeah, so as we have seen before, first of all, warning sign is some having some dental issues also. But also
Hmm.
one of a very easily foundable warning sign is having a foul smell. That means your
Hmm.
mouth is creating some sort of a smell. That is a first sign that you can get it very easily. Also, apart from all those dental issues, we have a lot of overall jaw related movements also which are visible in those. Means if you see the patients or the people who are doing mouth breathing since childhood, if you observe closely, these are some deeper facts, but if you observe them closely, you'll see their face from the side angle that little more convex. Means their teeth are getting come in a forward position while their chin goes back and the front face goes little back, and that creates a more of a convex face. These are
Hmm.
also some signs which tells you that they are a mouth breather or so. Also,
Hmm.
as I was talking, I just remembered, and I would like all of your community also to follow Badrinath in terms of breathing practices. That Shitli, Shitkari, and all those pranayam also helps keeping not only your breathing but also your dental health better. Because one of
Hmm.
my patient asked me some days before, doctor, can I do something home remedy to keep my gums better? Then I said,
Hmm.
yeah, I suggested him some dental home remedies. But along with that, these are some pranayama also which helps you to keep your teeth and the gums health better.
Hmm. With no cost.
Yeah, with no cost, obviously. See, brushing, flossing, doing pranayama, they are not at all costly process, right? But the dental
Hmm.
treatment cost. But most of the
Hmm.
people come afterwards because they don't want to take the responsibility of doing it. And that's why
Hmm.
it's my even earnest request to all of you that start not only focusing on your general health, but also on your breathing, also in your dental health, everything. And start, as you have rightly said, the first step to that is start knowing yourself.
Hmm.
That's a very important part.
Yes, yes, exactly. So, dear, whoever is watching this, doctor itself coming forward and explaining you. So he doesn't want you to suffer these problems. If you come to him, he is going to earn money, but he himself is telling you like not to come to him, not to go into that state. Means you have to understand yourself, like why a
Yes.
doctor is coming forward and explaining you about all these things, because he knows like where it is going to lead to. It's only going to grow, not going to go down. So at
Yes.
least by watching this video, at least implement few of the things which is mentioned by Dr. Hemant Patil. So coming to next question, nowadays many of them are facing sleeping problems. Like if you see like in India it alone, like more than 50 crore people having sleeping problems.
Yes.
So how can dental problems impact sleep quality and overall health?
Yes. So, uh, as I was just watching your channel, then I realized about you have some video on the insomnia and all also, and the doctor has covered a lot of topics. So, in
Mm,
terms of dental, if I say yes, as we were discussing on the mouth breathing itself, that itself also has a lots and lots of effect on a sleeping.
mm,
One is the biggest factor, and the second one is even the stress and related the teeth problems. Those is also affects that sleep pattern. So the first part, which is a mouth breathing, as we have previously also learned this fact that when we have a mouth breathing, and what happens in a mouth breathing is because we are not able to take a breathing through our nose, we start breathing through mouth, right? And when we
mm,
take a breath through mouth, a lot of times our mouth gets open, right? And you must have
mm,
observed in your family itself that a lot of people keep their mouth open, and sometimes they
mm,
start snoring also. They may
mm,
snore or may not snore. Even while mouth breathers may have a different types. They may mouth breathers may be snoring or they may not be snoring. And
mm,
those who snores, it's not only socially problematic that the opposite or the adjacent person gets a disturbance, but apart from that, the snoring affects the quality of your sleep also. And that's why it is very much mandatory, I would say, that you should focus on whether you are really snoring or not. And if you are snoring, you should visit to your doctor and also visit to your breathing specialist and start reducing those practices of mouth breathing. And if you are able to, the snoring will obviously reduce. There are some medical treatments also available, some devices also available to reduce this snoring problem. And I would initially, rather than going to all those medical treatments and all, I would initially suggest you, if you can just correct your lifestyle itself, that will also reduce your mouth breathing and the further the snoring problems. Now comes the second problem, that the teeth grinding, the stress itself create a lot of teeth grindings, and those teeth grinding also create a lot of stiffness in our muscles. And even this stiffness and this teeth grinding more happens in the night time. That's why if you are a mouth breather and if you have checked in the morning time, you must be feeling some soreness in your muscles or some pain in your jaws. And that happens specifically when you have a lot of teeth grinding happening. And that also affects on a sleep, because you are not, see, while we sleep, what happens generally is our metabolism and all being slowly taken care of, and we are not conscious. Our parasympathetic systems work, right? And that in that way we generally let ourselves be loose. But when we
mm,
grind ourselves, it affects, because we are not completely in a good sleep. That grinding will not allow you to get that ideal good sleep, but the quality of the sleep what we should get. There are a lot of depth in this about what is a NREM sleep, what is a REM sleep. That is a little beyond the scope, but at least is a basic. All those disturbances coming either from snoring, either from teeth grinding and all, will affect your sleep quality. And that's why it is very mandatory to identify how your breathing pattern, how your dental problems are, and to get them corrected at the initial level. And they obviously, they, as he has said, they don't cost you much when you get them at the initial level.
mm. Yeah, great, great. Wow, like this is very inspiring. Like I think we should write a book on like how to really maintain your dental health. Or like there might be many books are available already, but yeah, like how to recognize them, like
Yeah.
yourself. So because that itself like solve 50% of your problems. Recognizing your problem itself solve 50% of your problems. It will not lead to the surgery state or extreme state, right?
Yes.
So I think wow, this is amazing. Now comes very very important question and final question. So I know like you covered all these elements in the whole topic, but at the end, for our audience, are there
Yeah.
any lifestyle habits that can affect both dental hygiene and breathing, and what kind of lifestyle habits we should adopt?
Yes. So, first of all, I would say I would more focus on the bad habits, and mainly one of the
Mhm.
big bad habit is the smoking. So, yeah, smoking not only affects the dental but also affects the lungs also, and in terms of breathing practices also, and it has such a highly deteriorated effects that we not only affects our teeth, lungs, which are very easily anybody can understand, right? But smoking has lots and lots of effect on our overall general system also. And it's because it's an addiction, it creates a lot of other bad habits associated to that also. So smoking is a one of a very big bad habit that deteriorates our lifestyle. And I'm always try, we have a counseling sessions also as a dentist also, a lot of time for patients who generally have these smoking habits and even other smoking related habits like tobacco chewing habit, pan masala chewing habits and all those. But those also affect both as in terms of dental part also, and in terms of oral health, in terms of lungs health and the respiratory systems also. And then there are other habits also like mouth breathing, there are other improper, like when you don't exercise and all those are other habits also. Now comes to the good habits. The first and most important habit is to rise up early. And as pranayama and the yoga science says that when you rise up early, when you do your pranayama, you do your exercise, that keeps your lifestyle much better. Because even before I will focus this that not only because I'm coming on a Badrinath show, but even as a general also, when I'm practicing in the morning time about my pranayama practice, it helps not only to get more and more oxygen, but it helps you release your internal hormones, all those serotonin and all those hormones which keeps you more and more fresh. Those get increased, and also your oxygen flow also allows your blood flow to increase. And if all this happens in the morning, that gives you a boost of energy for a full day. Otherwise we see a lot of people coming up waking up at 10 o'clock 9 o'clock and they are completely lazy for a whole day. Yes, they may be talented, they may be hardworking, but they don't have that much energy which they can pass on to the front people, right? And that actually happens. So that's why the most important lifestyle habit would be rising up early and start with your pranayama. Obviously along with there are other habits like if I come to the dental part, then brushing twice a day, flossing in the night, and all those habits are also important. Along with, as I was focusing on the exercise, exercise is a very important topic, and not only like, whatever the way you are comfortable with, whether you are doing a gym exercise or whether you are doing a yoga exercise. But yes, exercise is an important part because it also induces your hormonals to the and also increase your blood flow and make you more and more energetic in the initial first part of the day, which is very crucial. As our ancient Indian science also says that, right? Initial first part, which is before the sun rises, that is something known as a brahmurta period, right? And that
Yeah.
time our energy is very high and we get something like a god like rays coming up from the upside and which energize ourselves. So when we are much ready in terms of doing pranayama, in terms of exercise, we are able to absorb them nicely. And I think
Wow.
Badrinath would like to express more focus
Yeah,
on
of
this
course, like
topic
a Brahma
about.
Muhurta is the best time for everyone to practice. But in case if you
Yes.
cannot able to wake up, it's fine. Whenever you wake up, you practice it, because I have tried this to implement in my community, but people are quite lazy. But slowly, you can progress it, right?
Yes.
So you don't initially, you don't need to wake up at 3:30 or 4 o'clock, but at least if you're waking up at 8 o'clock, next move to 7:30, 7,
At least
slowly
before
transfer it.
that.
And but whenever
Yes.
you wake up, exercise, integrating any form of exercise, we are not just promoting here like yoga or breathing, but any form of the exercise which will really help you to improve your overall health. So apart from this, Dr. Hemant, so one thing is they have to brush 2 times,
Yes.
and what else they have to do for especially to maintain the oral health, and also is there any food plays any role in the oral health also? Could you please explain that?
Yeah. So,
Yeah.
in terms of oral health, the first and most important part is twice a day brushing. Second part
Yes.
is flossing. If
Okay.
by chance the community may not be knowing about a flossing, then flossing is what? It's a some sort of a string what we get, or there is a string attached to the brush form also. And if you're not comfortable with that, there are electronic flossers also which have a water induced flossing also. So those flossing will allow your interdental teeth area to get it clean. And once you clean those, because see, when you use brush may not be able to go inside your interdental crevices, right? And that's why it may not be able to take out that food particles which are getting stuck between the teeth. And that's why doing
Mm.
flossing is a very important part. And I tell to this my patients that, see, a dentist cannot avoid your interdental decay as much as the flossing can avoid. And I have seen
Mm.
my patients who are using dental floss and the twice a day brushing since long, and they are not coming up with more decay. And the
Mm.
only thing which I suggest you to go to a doctor is just to have a regular checkups and cleaning. Yes, sometimes some patients ask me whether the cleaning is good or not, because it sometimes some patients feel that the cleaning may take your enamel out or so. But it's not something like, if you get it done from a good expert, the cleaning is very much advisable, and we do it as a dentist for ourselves also. So cleaning once a year, follow-up checkup every 6 months. This is a very initial treatments, not even a treatments, they are a preventive care. And if you do that, that doesn't cost you much also. But if you do that regularly, you don't go to that level where not only the cost but even the treatment discomfort also increases, because a lot of patients come to us for root canals, tooth removals, implant placement, jaw surgeries. All those are tertiary treatments, and I suggest all
Mm.
of you to come to that level where there is a preventive care. And apart from that, there is a one more thing which I started telling since 2 to 3 years to my patients after practicing on myself as a mindset coach, that there is something known as pre-preventive, which I say as a supra preventive approach, and that is make your mental condition also in a way better. So example, I am not a general health expert, but I'm a dental expert. So I tell my patients, keep at least one or two affirmations in your mind, and say those affirmations in a morning time about your oral health. Obviously you start saying about your general health also, but at least as a dental expert, as a oral health expert, I say start saying these affirmations for dental health. Because when you make your mind also in a such a way that I am more and more oral health wise better and better every day, that keeps you in a more of a preventive care mode, and not going to that stage when you are getting more and more treatments done. So that is a one important part which I would like to tell on this session.
Mm. And does diet plays any role in oral health?
Yes. Sorry, yeah, I forgot about that. So yes,
Yeah.
diet plays a major role. So I generally suggest, particularly the kids, that I see lots and lots of kids coming with too many decayed teeth and all that. Now, why does that happens? So yes, we cannot avoid our kids to eat from chocolates or even junky foods and all that, but keep those to minimum. Whatever
Mm.
minimum. See, this is a 21st century, we cannot avoid our kids to eat chocolate, but at least keep those to minimum. And whenever you are eating that, suppose if it's too much, like
Mm.
eclairs on all those which are sticky chocolates, do brushing apart from that twice a day brushing also, because those chocolate get stuck inside, and when they're stuck inside, they create a decay, right? As we have seen in the brushing and flossing. Why we do flossing? Because we are not able to clean those particles. So in the same way, if those chocolates stay there or stuck there, that creates a decay, right? So
Mm.
avoiding some type of a food which are junk, stuck, sticky, or more sugary even. And particularly for adults, apart from sugary, tell every adults avoid not only sugary but even acidic content like cold drink. I tell all of my patients, don't eat any cold drinks, especially those with the aerated drinks like Coca-Cola and all those. I'm not against any company as such, but yeah, why? Because those acidic content wears down your teeth, and I see a lot of patients come up with a whole teeth getting eroded. And when they ask, they say in the history that I have very much hard habit of eating at least 1 liter of cold drink or something per week or per day, whatever it is. And that's the one thing. And what to do is have more of a fresh fruits, more of a raw vegetables, and especially fruits. I would suggest, if you're eating fruits and if you like fruits, eat raw fruits rather than drinking their juices. Because eating
Mm.
raw fruits not only helps you getting those vitamins and all those which are good for your overall health, but eating those raw fruits allow your gums also to get massage. And also the vitamin C in the fruits helps you in keeping your gums also better. So
Hmm.
that's what we
Wow,
used to do
like
when we
then diet plays a crucial role, like, and also I think it's exercises, like chewing
yes,
exercises our this part, this region. Wow, wow, like this is amazing. Like, thank you so much, Dr. Hemant, for enlightening us with this information, and we got so many golden nuggets out of this session. So please watch again and share in comments what did you learn from this session. Share in comments, and if you have any questions, please comment below. Dr. Hemant Patil will be happy to answer all your questions. Thank you
sure,
again.
sure.
Thank you so much for taking your time, Dr.
Thank you,
Hemant.
Badrinath. See you
Yes,
all.
thank you.
Bye.
See you.